Right now, there are two theories that are kind of doing the rounds on social media with SARS-2, a lab leak hypothesis and a zoonotic origin of SARS-2, which means the virus came from a natural source of perhaps a wild animal and made it into humans. Now, are theories possible? All theories are possible. It's possible that we've come from Mars. It's possible the virus came on a meteorite. But then there are probabilities. Probabilities are based on data and numbers. So how probable is one theory over another theory? So, viruses like SARS coronavirus, the original SARS coronavirus, 2003, Middle East Respiratory Syndrome coronavirus 2012, there's good evidence that they've all evolved in bats, moved into intermediate animal species, and then moved into humans. But then there are other possibilities. For example, the lab leak hypothesis. Investigations do not necessarily mean it's happened. Investigations are great because investigations lead to evidence, which then leads to policies. So just because something is being investigated does not necessarily mean it's got more weightage over other possibilities.
It is our position that we need to get to the bottom of this.
Of course, when powerful states are interacting with each other, they're doing so trying to gain strategic power. If the United States can damage the reputation of China around the world, that is an active thing that the United States government is trying to do strategically. The same is true for China. And so what we have to do is have to understand that both of these things are happening at the same time. And there is no such thing as separating them out and having a non-political investigation in which the world goes to try to find things out. That would be great in some sort of land that does not exist, but that's not the world we live in right now. The heart of the matter in those 3 million potential deaths is politics. What we're actually seeing right now is a 2021 pandemic that's all about the inability of states around the world to cooperate, to coordinate, and to have a joined up response. Instead, what we've seen over and over and over again has been brinkmanship, nationalism, a focus on what's going on internally, closed borders, and hoarding of vaccines. In that context, the question of the origins of the virus actually take a back seat to the bigger questions, which are how could we build institutions that actually resolve these big questions? Many more people have died than needed to die. If we had been sharing vaccines from the very start, if we had been coordinating public health approaches,